Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Anna Kiger, who is the Assistant Chief Nurse Officer at Sutter Health, about how needle stick procedures interrupt care delivery. So, hi, Anna, how are you?
I'm doing great. Thanks for the call.
Of course. Thanks for being here. So let's jump right in. A recent survey reported that 11% of participants with recent hospital experience needed 10 or more needle sticks to obtain a single blood sample, and more than half required multiple needle stick attempts for a single procedure. So, how do you think repetitive needle sticks and other uncomfortable procedures impact care delivery and patient experience?
Unfortunately, when patients come for healthcare, whether it's in the emergency department or later on in the acute care setting, we do need to obtain blood samples from them for a variety of reasons. And unfortunately, in part due to the acuity of their diagnosis and their age, obtaining a clean single needle stick to get the blood can be very difficult in a selection of the population. Not to mention, is probably highest on their patient experience for rather you not stick me with the needle if you didn't have to.
Mm-hmm.
So it is one of the most frequent tasks that a nurse or phlebotomist does. So if you come for healthcare, it's a high probability we're going to stick you at least once, if not more.
Mm-hmm. Absolutely. And so, how do you think that CNOs and other nurse leaders can redesign care workflows to kind of lessen this issue?
We're always looking for ways to improve the patient experience. And for this particular topic, if we could come up with technology to remove the use of a needle to obtain blood, we would be significantly improving the patient experience. Again, we will take at least one blood sample from you, if not multiple samples. And over time, we can have multiple punctures in your arm or your hand where we obtain the blood. And if we could remove that and go to a needleless blood draw, it would be a wonderful improvement in the patient experience.
Absolutely. So, have you heard of any of those technologies that can provide an alternative to needle sticks?
There are some company that has developed a needleless blood draw for venipuncture. The device is currently owned by BD, which is a major supplier in the United States for intravenous and vascular access devices. This particular technology, which allows a nurse to obtain a direct blood draw through an angiocath, does eliminate the need for a needle stick. And that particular device can be used in the ED or in the inpatient setting. In patients that I have observed who have had their blood drawn with that device, it is painless, and the blood samples, at least in my organization, have been obtained with the same quality as through a needle aspiration. So if you can remove the needle and obtain a quality blood sample and get to the test result that is required for the physician to make a decision, then I'm all in favor of doing that because it's one less penetration of the skin, which is our protection from infections, and the patient gets an entirely different experience, a painless experience from us obtaining blood.
Absolutely. And I think the same study also revealed that like over half of Americans are afraid of needles in some capacity. So I'm sure that that would help make patients feel more comfortable as well.
There's a
Um,
significant amount of anxiety associated for the patient when an individual walks in with an obvious syringe and a needle attached on the end of it. Heart
mhm.
rate goes up, anxiety goes up. It's just if we can change that interface and take the needle out of the equation and obtain a quality blood sample, one of the most frequent things done in a hospital is obtaining blood samples from patients. I am all in favor of changing that patient experience.
Absolutely. So, what training do you think nurses should receive to help patients feel more comfortable and ease that anxiety during a needle stick procedure if it's necessary?
I think one of the things we need to do right now is just educate nursing and hospital leaders that new technology has recently become available to
Hmm.
allow for successful blood draws without the use of a needle. So, first of all, basic education, getting more literature out, getting more published research out, getting the experiences of those who actually use a device like this in clinical practice, and then also getting the patient's perspective out there. So, first of
Hmm.
all, it's education, broad education, clinicians, patients, and clinicians who actually use the device. Then I think it becomes a matter of showing that over time, this is actually an easier way to draw blood. It takes just about as much time, if not slightly less, to do it. And the patient and the person drawing the blood have a positive experience on both ends. The patient doesn't have pain from the needle, and the practitioner drawing the blood gets a sample that is of quality for the lab to perform the test. That's a win win for me.
Hmm. Absolutely, yeah. And you mentioned kind of nurse education. On the flip side of that, how can CNOs and other nurse leaders make sure that the patients are properly educated on needle stick procedures and how many they're supposed to receive, um, and also their alternatives?
Well, I think any clinician needs to start with communication with the patient that your doctor has ordered certain blood tests. I need to obtain those blood tests from the vein in your arm. Traditionally, I have used a needle. However, I have a different device that I can obtain the blood without the needle. And do I have your permission to use the device without the needle? Now, I'm sure the patient's response is going to be, yes, please.
Hmm.
And, an informed clinician, an informed individual drawing that blood with the needleless device, I'm sure, would like to offer the patient an opportunity to give their blood without any pain or any anxiety or increased heart rate from the anxiousness of that seeing that needle go into their arm. So I think educating frontline nurses in our emergency departments, in states where phlebotomists are allowed to use the device, educating the phlebotomy team, educating physicians, the provider who's actually ordering the blood sample to let them know that new technology has come forward that allows for an excellent blood sample to be obtained without the use of a needle stick. And I think once the healthcare team learns about new technology over a short period of time, they'll become in favor of it and they'll begin practicing more needleless blood draw acquisition than with a needle.
Absolutely. I think I, as a patient, would greatly appreciate that as well. I have a bunch of tattoos, but I do not like getting my blood drawn. So I can see how it would be helpful for sure. So my last question for you is how can CNOs make sure that alternatives to needle sticks are available in the hospital?
So I think for the CNOs, again, educating them that new technology is constantly coming out in healthcare, and this one in particular affords us a lot of opportunity. Number one, obtaining blood from a patient is one of the most frequent performed tasks by either a nurse, a phlebotomist, or a physician.
Mhm.
It is a majority of the sticks are done with a needle, and educating the CNO that a novel new technology has been developed and approved by the FDA for use in the adult population is available and that it is easy to learn how to use it. So it becomes an educational opportunity for BD and for those of us who have used the device to teach our colleagues about the advancement in this particular area of blood acquisition, as well as to share our positive experiences. better patient experience. Patient and family are more comfortable, and there's no pain being experienced. And from the hospital side, we get a quality sample. The blood lab can continue to analyze that sample. And at the end, the patient donated their blood. There was no pain, and I get the test results that the provider needs to make the next medical decision. So, education, and then for those of us, sharing our firsthand experience with the device.
Absolutely. Well, thank you so much, Anna, for your time. I'm really grateful to have had this opportunity to hear your insights, and thank you so much to our audience for listening.
Thank you.